Now, conditional response. This is called conditioning of brain. Conditioning of brain is a situation comes and you react accordingly. An angry person will react in anger in every situation because it is pre-programmed. A fearful person will react in fear in every situation because it is pre-programmed. Here I'll give you an example of the case also. You will see in the case also. If a child, at a very young age, a child has seen discords between the parents in the home, the parents were fighting and fighting and fighting, and in that fight the father has hit the mother also, and the child is seeing, right? I had a case, I will like to discuss it with you. There was a case, a girl, she had bipolar manias, and she says that, I have discussed in one of the seminars also. She says that whenever that for few days in a month in me, a lady comes, Maharani. She names her Maharani. That she comes to me and I react like that, Maharani, very aggressive, a very angry kind of lady. She comes in me and I react like that. And in few days after that month or in the next month, a child comes in me and the name of the child she terms as Charlie. She says, Charlie comes to me and he's very cute, he's very innocent, and he's very docile, and he's very adjusting and very calm. Right? I said, what, since when it started? And she said, it started in very early age of my life, at an age of about when she was very young. I said, when? She said, one day I went to my Masi, to my paternal home, and to my Masi's wedding, Masi's daughter's wedding. And there, I said, what incidences happened and how was your family atmosphere at that time? And she said, since childhood, when I was very young, she is the elder one and her brother is the youngest one. And she said that very early, since the childhood, I have seen my father and mother, they were quarreling, fights between them, and father used to hit mother very badly, and mother used to hit father also sometimes when it was to very extreme conditions. And she said that whenever father enters the home, he was alcoholic, and whenever he entered the home, I was very in a condition of fear that that today what he will do, whether he will fight with mom, or whether he will throw us out of the home in the midnight, or whether he will attack my brother. And she was very, very possessive, and she was a motherly figure to her brother. And when father used to say something to the brother, she used to react, right? And when she went to Masi's home, she saw that there was a very peaceful condition of the home in the marriage. She saw that the kids, they used to play with mother and father, and the Masi and her husband, they were having a very very harmonious relationship. And Masi used to ask something to to her husband, and he used to respond in a very calm way, and there was a very good condition and atmosphere of the home. When she came back from that home, she saw the mother and father fighting again, and father was hitting the mother, and she fainted. And when she fainted, the mother and father diverted their attention totally towards her. They ran towards her, they took her in arms, they put water on her face, and they both together took her to hospital. And she saw that because of this, what happens is the quarrels have stopped. I'm not telling she was doing it very conditionally. I'm not telling she was doing it very purposely, but this happened. And she said, whenever the father used to enter the home, I used to be very, very fearful. Whether father does something or not, because sometimes father came and he used to sleep in the bedroom. He did not say anything to anybody. And once in 2 or 3 months, he used to fight. But this was, I will come back to the topic again, because if I will discuss the case, it will go very longer. Back to the topic, I wanted to tell you that the brain has created a neural circuits already, that father will come, he is alcoholic, he will hit mother, and there will be fights. Father came, knock hua door pe, she became fearful. Amygdala alerted. No, something will going to happen. Father has come now. This is called conditioning of brain. And she reacted automatically. When father came, he did not fight it with the mother, but she used to faint. She used to faint immediately. She used to have Maharani in her and she reacted accordingly, throwing things. She used to be very, very fiercey and she used to be very, very aggressive and agitated movement of her life. And whenever father used to come, she used to react like this. Maharani came. She says, Maharani comes to me. And father and mother's whole attention were toward her. This is called conditioning of brain. That now nothing is going to happen, but the brain is responding, pre-wired, pre-programmed. This is what I'm trying to tell you. If a patient comes to you, what is the condition behind? We have to see what has created this kind of patient. What is the root cause of this reaction? What the patient is doing? She is becoming Maharani, but what is the cause behind? Why? The fights between the parents is the cause. Okay? The fight between the parents, the unhealthy environment of the home is the cause. We have to hold that cause. This cause, Dr. Hahnemann has said this, PSORA. We will link it to the further slides. This is PSORA. If we will catch that the patient is very angry, he is this, that will be a symptomatic prescription. That will be a prescription on symptoms. We have to go to the conditioning of mind. We have to go to the pre-programmed wire of the this thing, that what has created this? Why is amygdala at an alert? Which alert is amygdala signaling? Why is the fear creating this kind of patient? Clear? We will further link it to the next slides. This is the pre-programmed conditioning of, this is the neural circuits which have already been created in the primitive brain and in the middle brain, because neocortex is emotionally hijacked, because neocortex is not given the time to give a rational answer to why. If the father is coming, neocortex will say, no, the father is not doing anything, you don't have to react. But there is emotional hijacking. So neocortex is not reacting to that. Now only two things are reacting, hippocampus, amygdala. And in reaction, who is coming forward? The primitive brain. Yes. So conditional response, one learns that specific stimuli is associated with danger, and as such anticipations of subsequent encounters with the stimulus produces a physiological stress response. I have already told you, I'm just reading it. We'll go to the next slide. For example, a child who is abused by the parents may experience a physiologic stress response in anticipation. Two reactions बताए मैंने, one was reactive and one was anticipatory. If a child is being abused by the parents, the next reaction would be anticipatory reaction of further abuse, कि आगे फिर मेरे साथ abuse ना हो जाए. Right? That abuse should not occur again. For example, if a child, I would like to share another example with you. If a child, for example, is being sexually abused once in the childhood, till further, if he's not been treated, till further at her teenage or at her early adulthoods, till then also the child will not allow, the girl will not allow anybody's touch. She will be very, very alertive. She will be very, very assertive with the touch of anybody, because her pre-programmed brain, the amygdala will alert, and the pre-programmed brain will bring forward what thing? No, sexually, that experience which have been stored in the hippocampus, because neural hijacking hua hai, because the neural circuits have already been created, and conditioning of brain will alert. Am I clear? I wanted to tell you with multiple examples so that it becomes clear. So we do not have to pick that the child is touch aversion or she does not. We can, but the root cause has to be picked. Why is she like this? Because amygdala has a fear. Fear of what? Fear of these kind of things. That if a boy or a male will come near me, he will always sexually exploit me. Right? For example, a child who is abused by a parent may experience a physiologic stress response in anticipation of further abuse when the parent enters the room. The same condition with the Maharani one patient. Under same circumstances, these memory programs become so strong that the disorder starts developing. And these kind of disorders develop phobias, flashback memories, sleep disturbances, neend na aana, the patient is restless, depression, post-traumatic stress disorders, PTSDs. All these comes because of such conditioning of brain, because these conditions have already been stored in the brain, because the subconscious has an alert and we usually react in the same way. So these are the diseases which are created. We say the patient is phobic. The patient comes to be with phobia, water phobia, heights phobia, male phobia. But why is the patient in this condition? Why has the neocortex not working, that if you are going to near a river or if you are taking a bath, that water is not harmful? Why has the neocortex being emotionally hijacked? Because amygdala is an alert, and amygdala is an alert and the primitive brain is in action, right? Emotional hijacking, I have already explained you. I will go through quickly, read this. Emotional explosions are neural hijackings. At those moments, evidence suggests a center in the limbic brain proclaims an emergency. There is a center which proclaims emergency, and that center is amygdala. Recircuiting the rest of the brain to its agenda. The amygdala has a so strong effect on the brain that the whole brain recircuits according to amygdala. The hijacking occurs in an instant. It occurs within seconds, triggering this reaction. Crucial moments before the neocortex, the thinking brain, has had a chance to glimpse fully what is happening, let alone decide if it is a good idea. The hallmark of such hijack is that once the moment passes, those so possessed have the sense of not knowing what came over them. When the moment passes, when the things have gone, then when amygdala settles down, then the neocortex comes in action, and then the patient says, what happened to me? I was not like this. In that patient, when Maharani came, she was in an aggressive form. But when Maharani go, she became Charlie, very docile, very, very polite, very, very mild, and very, very fearful. Because she did not, when she was in an aggressive mood, after that she says, I don't know what happened. It was not under my control. And I forgot. There was nothing which I remember that what was going on. Right? So this is emotional hijacking. Emotional sentinel. The research has shown that sensory signal from ear or eye travels to the brain. First, as I told you, whatever the sensory organs, aapne dekha, suna, will go first to the thalamus. Thalamus is your main principal of the school. First, it will go to the thalamus and then across a single synapse to the amygdala. One relay will go to the amygdala, and second from the thalamus goes to the neocortex. This I have already explained. I am reading it. The second goes to the neocortex, and which is your thinking brain. This branching allows the amygdala to begin to respond before the neocortex, right? The same thing which we have discussed, that the amygdala responds before your rational brain, which nulls the information through several levels of brain circuit before it fully perceives, and finally initiates its more finely tailored responses. This circuit does much to explain the power of emotion to overwhelm rationality. This is the condition where emotions get havi, where emotions get overpowered on your rational brain, on your thinking brain. The emotions have overruled them. In a very simple language, the emotions have overruled them. For example, a mother becomes very possessive for the child. She phones her, telephones her again and again, again and again, again and again, guiding her again and again through thins and thicks of the life, through the loopholes of the life. She does not allow the child to be very independent. She does not allow the child to make her own decisions. She says, no, every decision will go through me because I'm very possessive. Why? Because the child gets married also, and then also she is telephoning her 1,000 times a day. The girl is also telling everything to the mother, and the mother is taking in charge and control of the home, because the neocortex has been hijacked. The neocortex is not giving a rational thinking to the mother that now the girl is married, you don't have to interfere in her home, because amygdala is at an alert, and the primitive brain is in action. correct? So these are the various examples of telling you how our neural circuits get hijacked. Anatomically, emotional system can act independently of neocortex. As I told you, when neocortex gets hijacked, emotional system takes the main rule in your brain. Some emotional reactions and emotional memories can be formed without any conscious cognitive participation. The amygdala can house memories and response repertories that we enact without quite realizing what we do so, because the shortcut comes from thalamus to amygdala, completely bypass neocortex. As I have told you before, this is the same. I have explained you. I will go through the slides. Just read them. This bypass seems to allow the amygdala to be a repository for emotional impressions and memories that we have never known about in full awareness. Sometimes what happens is, for example, I would like to share that a child is born. When a child is born, he has fear of dadis. Sometimes you must have seen, I will discuss the case also. Fear of grandmothers, right? The child becomes aggressive to grandmother. Whenever grandmother enters the home, or whenever grandmother shows love to the child does not receives the love, does not respond to the love. The child is very, very indifferent towards the grandmother. Right? Now, what has come in the, why is amygdala in alert that he's not responding to dadi? Because the child is a newborn. When the newborn baby, also the child, the dadi carries the baby in her arms, the baby cries. The dadi has to give to the mother. For few minutes also the child, the dadi did not carry the child, because the child becomes very, very, she cries when the dadi picks her up. The thing is that the child's memory, hippocampus, has already taken an impression from the womb of the mother, because dadi has been very, very harsh towards mother. The dadi was very strict. The dadi was very dominating to the mother. The dadi was not at all caring in pregnancy to the mother. Dadi used to make the mother do all the household works. And what was the feeling the mother was? The neocortex was not working because of the mother, because it was hijacked. Amygdala, fear create karta hai. Dadi has come, I have to do all the work. In pregnancy also, in 7th, 8th month also, jhadu lagao, pocha lagao, do all the groomings, do the utensils, do the household chores. Who is making the patient's mother to do? Dadi. And what is the emotion which is coming in patient's, the child's mother? Fear and anger. Anger to the dadi and fear. And this is already being going to the child who is inside the womb of the mother. The hippocampus of the child, or the brain of the child, the back brain, hippocampus develops after 3 years of life, but the pre-programmed brain, the back brain, which is first to be formed in the womb of the mother, is already taking the impressions of the mother that dadi is cruel, dadi is harsh. The pre-programmed brain is getting programmed according to the situation. And when the baby comes out of the womb of the mother, the pre-programmed brain, when dadi holds the baby, gets alert. Amygdala alert. And the child cries, don't touch me, don't touch me. And the reaction is crying, because small baby cannot speak. And dadi have to hand over the baby to the mother. Several cases have come where the child grows up and he beats dadi. At the age of 7, 8 years, 6, 7 years, 3, 4 years, the child hits the babies, dadis. Why? Because the pre-programmed brain is reacting according to the situation. Because mother has felt uncared, mother has felt lack of love, mother has felt fear of domination. Due to that, the child has carried the same emotion from the amygdala. This is the cause The reaction is the child. The cause is the mother. This is, at this point, I would like to share, this is the point where Dr. Hahnemann has said PSORA travels from generation to generation. PSORA has traveled from mother to the child. It has traveled from this in the womb of the mother. The pre-programmed brain, which we called subconscious mind, it has already taken the impression of the dadi being like this. It has already taken the impression of the mother's subconscious that the dadi is like this and you have to react like this. This is PSORA traveling from generation to generation. Dr. Hahnemann has very clearly said in Organon of Medicine.